example of how at Hiya Health with our athlete performance program, we can use our best technologies available, which is our VALD hub, and our knowledge of the evidence, which is over here on the right, to help athletes make the best training decisions for their circumstances or pathologies to get them to reach the highest performance or back to the health that they need to be. So on here we can see some different types of strength. Now, our VALD equipment that we have available for testing allows us to test all of these different buckets of strength. Heavy dynamic strength, which is your normal like squats, fast dynamic strength, which is jumping, reactive strength, which is neuro system stuff, explosive strength, which is again more of a nervous system thing, and maximal isometric strength, which is how much you can produce your force. Down here we have something called an eccentric utilization ratio, which goes into our fast dynamic strength bucket to see how well you can use your tendons. So luckily with our VALD force deck, we can get all that information to help someone know which bucket of circles here that they need to train into to get the adaptations. Here we can see someone who has a 34.7 centimeter counter movement jump at a 58th percentile. They also have a 41.8 centimeter squat jump, 93rd centile. Now, having this VALD hub information has actually allowed us to see those two things right from the start and think, hey, this isn't quite right. You should be able to have, as we can see down here, something called an eccentric utilization ratio, which is how well you use your tendons to create power, right? And that should mean that it is your counter movement jump divided by your squat jump. And that should come up with a positive, if you're using your tendons well, that should come up with a positive ratio of about an extra 10 to 20% is ideal, with about 15% being ideal. So here we can see that this is a negative ratio, right? So this athlete isn't getting anything back and is actually losing some from going down in a counter movement jump versus a squat jump. The next thing that we can see is this athlete has so that already tells us some bits that we might want to be looking at as, okay, they might not be using tendons in a vertical plane. The next thing that we're going to look at, okay, is an isometric mid-thigh pull test. So this test here tests our maximal isometric strength. Now we can see this person is relatively strong, okay, so when they're pulling, mostly with their posterior chain, okay, they can pull and they're on the 79th percentile. Interestingly though, with what we can also get here is this explosive strength number through your rate of force development, which is how quickly they can produce that force. So we know that they can produce a lot of force, but at 1,415 newtons per second, they can't produce that force very quickly, only down the 14th centile. Here we're thinking, okay, there's going to be something, some nervous system related. So if they have enough time to produce force, they can use all of their muscles and neurons to actually fire and get the force they want. But if we're constraining it and making them do it quickly, it can't work. I wonder what's happening there, and I wonder if that ties to our previous thing, where they're able to not use their tendon very well. Okay, so then we go into the drop jump, okay, which our drop jump tests this bucket up here, which is reactive strength. All right, so with our drop jump, this again is a nervous system type thing. It's how quickly they can use the force that they have. All right, so they are only in the 36th centile, 0.84 meters per second, quite slow, right? And the amount of power that they're outputting is quite low, okay? But the height that they're jumping is actually quite high. So this is someone who is strong, as we can see with the isometric mid-thigh pull, doesn't use their tendons super well, but can, if giving themselves enough time, jump relatively high. So they can use their strength to produce a lot of force and go very high with it. But if they're asked to do it quickly or asked to do it in such a way that they're focusing more on their tendon, okay, then they're not actually getting a lot of benefit. So this here can kind of show that this athlete needs to work on their rate of force development and some tendon adaptations. and very likely has something like, and as you see, they have an asymmetry to the right in everything, very likely have something like a left knee tendon kind of issue, patella tendinopathy, and possibly even some chronic pain related kind of signs there, where our brain has an accelerator and a brake, basically things that make us go and go really quick and things that hold back, and it has some bits that are telling it to hold back because it can produce a lot of force, but it wants to feel it out and not let it produce that force quickly. So that is how we can use our VALD technology with our best available evidence to make sure that we're getting the appropriate training response and training program for our athletes and clients.